essentially talk about what is the data that has been analyzed, what is the basis of this, and really why we have done this kind of a dashboard, which basically compares 2016, 17, 18, and potentially we want to do 19 as well, PM 2.5 and PM 10. And I think it just gives a very clear snapshot. We have 1 hour. I will let Ronak speak for about 15 minutes or so and take you through the dashboard and explain what it means. I then also have with us two other speakers. There is Santosh Harish. Dr. Harish is a researcher and a fellow, a scholar on air quality. All of you know him very well. Has been working on just advising a little bit on how the tracker should also be looking, and Santosh will give inputs on the policy aspects of how this can be used and what this means. We also have, I see Dr. Arun Sharma has joined. Professor Sharma is at the University College of Medical Sciences, Delhi University, and has been also working on air pollution apart from working on COVID. And thank you very much, Dr. Sharma, for joining us. I think, given that there are some of us here who might be quite interested in how the overlap on COVID and air quality is looking, that's the very obvious question these days. Maybe, some kind of experiential or anecdotal inputs that you can give, even if there is not hard evidence or data at this stage on what exactly, the numbers are looking with respect to COVID and getting exacerbated due to bad air quality, but I will let you speak on that. I also understand, Dr. Sharma, that you might have to drop off, but if that is okay, I will at least let Ronak give the introduction to the dashboard first, and then then we will come to you if that works. And I will, yeah.
Am I audible?
Yes, you are.
Okay, fine. So I am actually on the highway and I'm driving. So the internet connectivity may get interrupted, but I'll definitely wait for Ronak to speak, and after that I'll join in. I'll speak after
Okay.
that.
Okay, thanks, Dr. Sharma, and happy to note that you're on the highway. um, uh, yes, Ronak, over to you.
Great, Aarti. Thanks so much for the introduction, and glad to be on this webinar. Appreciate this, everybody coming, especially all the participants taking time out. I mean, air quality is the topic which comes up, every winter. So, I'm going to jump into what's known as the NAMP program. And Aarti said, that our team and her team have been looking at the government regulatory data since more than a year, since the NCAP program was launched. And as Aarti said, the NAMP, the entire NCAP program and the selection of the 122 cities was done on the basis of the data from the NAMP monitoring network. So I'm just going to quickly, there are 2 or 3 parts I'm going to, touch upon. Firstly, I'm going to do a very quick 2 to 3 minute overview of what exactly is NAMP and specifically what are the manual monitors, because this is a program which has been running for a very long time. The documentation says it's been running since '84, but data is being reported from the NAMP program since 2016 in the public domain. So we have access to data from 2016 onwards. And just to quickly touch upon what exactly are manual monitors, I'm going to show this screen over here. I think you guys, can you all see this screen?
Yes.
It's a small visualization of what is really happening in the NAMP program and what are the monitors. It's a very simple device. It takes in air. There is a filter, basically, which the air is passing through, and the orange dot, which has the particles, the PM10. Essentially, the NAMP program was designed to monitor PM10 levels. And the way it runs is that there is a motor inside this device. It runs for about 8 hours and captures the particulate, the PM10, for about 8 hours at a stretch. And then this is physically weighed. And this whole process is repeated twice a week under the NAMP program. So 8-hour samples are taken twice a week and physically weighed, and then the data is reported. And so these are also known as high volume samplers. So they can be called gravimetric or high volume samplers. When you hear these terms, they essentially mean these kind of manual monitors. where filters are collected and physically weighed on a weighing scale. This graphic which Sarath has prepared, which shows us, and then this data is then typically collated and uploaded onto the CPCB servers. Typically, while this whole process can take a week to complete, the data becoming in the public domain is made available only about 3 to 4 months later. So the significance of this data from a citizen focused perspective, has limited value, but it has significant value from the sense that these filters are used for chemical characterization and speciation studies. So anytime you hear that any chemical characterization for beyond PM210 was done, be it heavy metals or be it the pH, which people use for health studies, are all done using filters from these kind of manual monitors. So this was a quick 3-minute overview of what exactly is this data that we are looking at. So coming to the actual NAMP program, like I said, data has been reported for 3 years in the concentration levels. 2019, CPCB shifted to reporting only AQIs, even from the manual monitors. So we are not comparing 2019 data with 2020. I mean, sorry, with the previous years. And even within 2019, so far only October 2019. So literally a year ago's data is only available. So there is no data available beyond October 19 and for the whole of 2020. And in times like COVID, these kind of monitors become an even more challenge. I don't know how much data is going to be reported for 2020. So that's one of the inherent challenges. Also, just a quick summary of the economic requirements of running this kind of a program. Typically, these monitors cost about 7 to 8 lakh rupees, and an operational cost of about 3 to 4 lakhs per year is incurred in running each monitor. India has about 800 of these running. So, so cumulatively, we are looking at about a 35 to 40 crore kind of a program over here. And what have we really got from that program is the data, and it's important for for the public to get a handle on what exactly is coming out of this 800 monitors that are running nationwide. So what we've done and what I'm going to do here in the next 7 to 8 minutes is walk you through the different ways that we've made this data available. It is a technical dashboard. We've tried to make it available as much as possible in a lay audience perspective, but you can download this data in any format that you want. All of these dashboards have, this link is actually on the public domain on the Carbon Copies homepage. So I'm going to explain, essentially, there are 4 different ways that we've looked at this data. We downloaded this data for the 122 NCAP cities. And like I said that, the NAMP program said 104 readings per year are necessary for a location to say that it is representative of the air quality of that location. For the data to say that it is representative of that location, many cities are running multiple monitors. So when you look at the cumulative number of readings that are made available, they could vary. And this first table actually tells us that how, I mean, it has a list of all the 122 cities, which has been filtered at the year level. So I'm just looking at the 2018 data, which is the most recent concentration data we have. The number of monitors per city is shown here. And we've said that if 104 per location, if the monitor is run well, we would be requiring 104. So in this first case, Vijayawada has actually reported about 30% less cumulative number of readings than what it should have reported for 9 monitors. So while we are looking at the number of 77, we should always look at that number in the context of the number of readings that are made available. So the lesser the number, in this, the better is the overall uptime, as we call. We define a term called uptime of the monitor. And in this case, it's just about 1% less. While this Chittoor, as you can see over here, has just a single monitor, and it's about 107 readings. So it is about 3% more. So this table is essentially to give you a sense of the performance of the monitor. How much is it of the baseline 104 standard that is set by NAAQS, which is a government standard. So some monitors like Guwahati is definitely being run well. and some others are not. So this will give you a quick sense, and you can typically find out which are the best run monitors for a given year over year. So this is as far as the first table goes, and all of the 122 cities are there in this. This one is also a combination of the same set as we showed above, but this one will allow you to quickly look at. So I'm just going to remove the base when you the basic view you will get when you come to this one is this particular chart will tell you which states and which cities are reporting how much further away from the baseline standards. The horizontal line is the number of readings required by the NCAP or NAQS, and the vertical lines are the baseline for the particulate matter levels, concentration levels. So we are looking at these are yearly averages of 40 and 60 and 104. We can see here that in terms of states, there are a number of states who've done a good job of running their monitors, West Bengal being one of them, who are running 21 monitors, and they have cumulatively reported more than what is required. But a large number of states actually have at least reported their number of monitors, number of readings which are less than what is required. So it is so, and the further away on the right that a bubble is, the higher is the concentration. So Jharkhand over here has 3 monitors, and its average for the year is 263 for PM10 for the year 2018. And this one actually you can drill down at the city level also. So it will give you a much more fine grain. And let's say if I just increase the number of readings to what the baseline is supposed to suggest at 104, then we have this list of cities where you can see that there are some cities which have done a very good job of running the monitors at 185 reading. That's pretty much the whole year that it has ran the monitor, and it's reported PM, which is 82, which is close to the standard. But there are some others who may be reporting much less PM levels. Let's say a city like Akola or Jalgaon, where or even this one, Chittoor, which is below the standard, but it's it is reported only 1 monitor. Smaller the bubble over here, the less the confidence in the data. Essentially, the message here being that the larger the bubble and higher it is in this graph, the more the confidence in the data. So typically you don't want a city to be represented just by 1 or 2 monitors. Given these are manual, you at least need 5 monitors kind of per city. So this graph in a very quick sense is going to tell you how to build confidence in which cities monitoring data. And of course, the further on the right the bubble is, the more the polluted the city is. So Allahabad, at 231 is a significant problem with a reasonable sized monitoring network. And so this basically will allow you, and this is particularly useful for local media who's reporting at the city level, that they can quickly zoom in on their own city and find out where it is vis-a-vis some of the other cities in the state. So this is the second graph that you can get to see. The third one actually is just to kind of give you a temporal trend or a year-on-year shift in the PM levels, specifically the PM10 levels. And we can see over here that some of the cities, especially in the green, are actually improving, have improved year-on-year. So if we take Agra, it improved between 16 and 17, but it worsened between 17 and 18. And the percentage is shown over here. Again, all of this data is available for you to download into your spreadsheets, and you can analyze it the way you would like. But a basic level of analysis is available over here, and you can quickly go and check for your own city whether it has improved or not. So this is basically a year-on-year comparison. This one will actually tell you in one glance which are the best and worst cities. So this is typical, the classical rankings that you get at the city level. And not surprising, Noida is turning out to be the worst city in for 2018 according to the NAMP monitoring data. It has reported 263. So whereas there are some cities here, Davangere and others, Guntur, which have reported within the standard. Having said that, all of these locations which have reported within the standard, one should cross-check on how many monitors were there and how many readings were there. So if it has reported, really few readings, then it may be, not an accurate representation of that city. So this data will allow you to find your own city, and then you should put it in the context of the number of monitors and number of readings per monitor. Um, so this is a quick glance of the actual PM levels and the rankings of the cities. And this is actually a ranking of the number of monitors, number of readings per location. So you can come to know which are the more well-run monitors versus which are not. So, and all of the ones below the blue line are the ones who actually not reported adequate number of readings. So at least the bottom 10 locations like Guntur again, has only reported 64. So even though their readings the PM might be less for the year, it could also be because it's not captured the real number of uh, PM levels through the year. Now 2019, the regulatory framework started reporting data in a different format. And that is why we've not kept this data combined with the earlier 3 years of data. The AQI, as you would know, is actually does not have any unit, and it's not a representation of the actual concentration levels, but it's a formula applied to convert multiple pollutants into a single number. So, and the prominent pollutant. So while a 78 of PM10 is not the same as 78 micrograms per meter cube of PM10. So that's the challenge, and hence 2019 will need to be looked at differently until CPCB reports the actual concentration levels. So brief, and then some amount of information is made available over here, where you can see what exactly are the baseline levels by WHO and yeah, by the Indian government. So I think this is a quick summary. I'm happy to answer questions, and there are some insights. A lot of insights can be drawn from this. I'm not going to be jumping into the actual insights on this talk. I think our carbon copy, the team will be sharing some more additional insights, but more on the technical and the data and the program side. This is a quick overview of the whole situation. I think that's about all from my side at this point.
Thanks very much, Ronak. Very, very comprehensive. And I must say, for everybody's benefit, that we did not say it properly, but this webinar is the release of this data, and it wasn't available before. And we are putting it up online today, and you all can also see it. Ronak has explained in quite a lot of detail how to work around with this. We can also offer more explanation if needed. And Gunjan has some of the the city and the state level highlights, which spring quite a few surprises, and we will share them with you. Things like, and if I'm not wrong, Ronak, only about 15 states even had PM 2.5 NAPM monitoring system for any years. The others didn't even have. So and I guess we tried to have CPCB here on this webinar, and we were not able to get anybody from there to participate and speak. But I think the valid question to also ask is just simply for CPCB to make the PM 2.5 and 10 also available on their website for transparency's sake, even if they are measuring 2019 onwards, I would say through a composite number of the AQI, but making the 2.5 and 10 available for for public download as well will be able to help in how NCAP will assess progress, because otherwise, you're stuck with manual monitors 16, 17, 18, then another way of measuring things 2019, and what do we measure our progress against. But let me just pause and invite Santosh. Santosh, you have looked at this partly and you have looked at everything else a lot as well. Do you want to share some observations of the highlights of this tracker as well, and maybe some thoughts on how this can be used, where the discussion on data lies with respect to the various other narratives that are being discussed on air quality right now?
Sure thing. I hope I'm coming in clear because my signal is a little dodgy.
So far, good.
Okay, excellent. So, firstly, congratulations to Urban Sciences and Carbon Copy for adding this dashboard to their now growing suite of dashboards. I think it's an important inclusion. Um, I mean, for many of you, and actually even for me, the continuous ambient air quality monitors may have been sort of your principal source of data, right? I mean, that's oftentimes what we end up talking about. But for the purposes of tracking year-on-year progress among the NCAP cities, it's important to recognize that for most of those cities, you have very, very little by way of continuous monitoring data, especially for the early years. This is something that's going to expand. It's something that's going to improve over time, but that brings with it its own set of challenges in terms of comparing, let's say, 2022 with 2018 and so forth. So, in some ways, the NAMP data will likely be sort of the principal sort of source of information on how air quality levels have truly changed over time, right? So I thought I could sort of quickly give a very brief background on this question of tracking progress and the role it plays with NCAP and with the new Finance Commission stuff as well. And then talk a little bit about how I think the dashboard provides some critical inputs, given that background. So, as all of you know, NCAP provides target of a reduction, by 20 to 30% from in 2024 compared to 2018. In parallel, you also have the Finance Commission grants, which go a step further in actually linking the grants to year-on-year air quality improvements, right? This is the first year of it. I don't know if any of the money has been released, but it seems like something that's going to be something that is sustained over a 5 to 6 year period. And in that case, sort of these year-on-year improvements have implications in sort of terms of real money given to the cities. So it's especially important for us to get those numbers right. More generally, tracking pollutant and specifically particulate matter annual average concentrations provides an objective way of sort of verifying whether air quality levels are improving at all. There are different kinds of statistics you could use. Something that has become increasingly common for CPCP, for example, to cite is the number of good to moderate days or the number of poor or worse days, how this has increased or decreased over time. But annual averages have many advantages, and chief among them is that they're able to speak better to long-term exposure to pollution as opposed to sort of these episodic highs and lows, right? It might be more robust also to the quirks of meteorology. When we are comparing levels from one year to the next, we need to take a few factors into account. One, meteorology and weather conditions always play a huge role. For this reason, for example, the US EPA relies on these 3-year rolling averages. And CSE has also sort of gone by that and proposed that we use 3-year rolling averages instead. The other challenge in comparing across years is that the composition of monitors could change. Over time, obviously, the number of monitors measuring air quality levels in a particular location, in a particular city increases. So it's possible that, let's say, residential areas are better covered over time. Or industrial areas and traffic junctions might get measured in some other cities. What this means is that when you're looking at your citywide average, right, this composition sort of might lead to its own sort of trends, and so we need a very ideally what you would like to use is the same set of monitors um, being compared across the years, and that set representing the different types of areas in a city and so on. It's not going to be that ideal case, but we need to keep in mind that this composition can play an important role. Second, the data gaps. Your annual average could easily get skewed if weeks experiencing very poor or indeed very good air quality levels are missing. Experience suggests that it often happens to be the very poor weeks that go missing. But regardless, it's important then that there is a minimum level of data availability across the year from each of the monitors for those annual averages to be reliable. Right. So for these reasons, it's important to have a clear, well-established, systematic way of comparing monitors year on year. And official analysis needs to be coupled with transparency and transparent in terms of actually getting those underlying data out into the public domain, and replicability. Right. And I think this is precisely where the dashboard plays an important role. The NAMP monitors will remain sort of the principal sort of base to compare air quality levels over time, and this dashboard sort of gets some of the data out into the public domain in a manner that's very accessible, where you can do a bunch of typical types of analysis that you would be interested in doing, and it calls out the data gaps. And I think that's crucial, right? So as the graph that Ronak showed earlier shows very clearly, despite this program being more than 30 years old, or perhaps because it is 30 years old, and there's this sense that NAMP is going to get phased out, and we are going to rely more and more on the continuous ambient air quality monitors. It's possible that the data gap situation here actually worsens, and that leaves us neither here nor there. We can either rely on the continuous monitors because there just simply aren't enough of them, and the NAMP data become less and less reliable over the years. So I'm very glad that this dashboard sort of makes this information easily available. In addition to the total number of points that are available for a particular year, something to keep in mind, and I think that might be accessible from the data that can get downloaded here, is when those gaps happen. If it's the case that almost 1 or 2 months went missing, and those 1 or 2 months happen to be November or December, then it becomes even less useful in the case of, for example, North Indian cities especially, right? To this point on how continuous monitors are still missing, I was just sort of taking a quick look while Ronak was speaking. So if we look at, for example, Andhra Pradesh, right? Vijayawada, for example, has only 1 or 2 monitors, and at least last time I checked, none of the monitors were active. Vishakhapatnam has 1 active continuous monitor. The NAMP data, on the other hand, comes from 9 stations each, right? And this sort of story repeats in every other city as well. So so I think that makes this particularly useful. Some things immediately jump out. The 2019, this sort of change in format, that's definitely an issue of concern. I mean, ideally, we would continue to have those more granular monitors data. I mean, this monitor measured on this date, these were the levels kind of information available throughout. I hope that's something that CPCB can sort of correct. I'm happy to talk a little bit more, but I think the last thing I wanted to mention was kudos to the team for also including the brief primers on the source of the data, the background, the pollutants. It definitely helps in making this thing more accessible to a larger audience.
Thank you, Santosh. Just one question, if it's useful to give a little more detail on, because oftentimes when we have government press briefings, there is always a discussion of how many good air quality days have increased over the last 2 years consecutively, and therefore, the impression that it gives is that air quality is improving. But here, if you see, for instance, like Delhi, and we can, once everybody can access. Also, they will find it just shows, I think, that the Delhi data showed improvement from 2016 to 17, but from 17 to 18, the PM 2.5 actually increased. And we don't have it for how it looked between 2018 to 19. My simple question to you is, how do we explain in terms of good air days, bad air days, the kind of a terminology, as opposed to, what these readings reveal, and your other idea of people like US EPA actually looking at 3-year rolling averages? I mean, just in terms of what our government is using as the basis to convey what they are saying, where are we on that?
So my sense is that CPCB, especially for Delhi, relies almost exclusively on the continuous ambient air quality monitors, and there might also be, based on some conversations I've had, there might, I think there is this strong feeling that, look, we have a clearly superior source of data through those continuous monitors, and therefore ye NAMP jo bhi hai, I mean, we are doing this still, but we don't actually use it for any sort of systematic sort of governance question. So, to your point on 2018 being higher than 2017, but this improvement being, so this is exactly why those either like a 3-year rolling average type approach is useful, or more involved statistical approaches to control for weather, and sort of trying to understand those long-term time trends is crucial, because that's going to keep happening. It's not the case that because we have a lower annual average in 1 year compared to the previous year, there necessarily has been improvement. It might be partly that, it might be partly in sort of more favorable weather conditions and so on. To get a sense of how it's actually improving, you definitely need to have the sense of that longer term time trend. Interior, just 1 year compared to another year type comparisons can be fraught with issues.
Right, right. I think later, if there are questions, we will come back to you on this. I mean, I think certainly on the one hand, you're looking at having a system where we have many years, 2-3 years of average to be able to take the decisions. And on the other hand, we still talk about air quality in the season. And, there is very minimal interest both among the policymakers and anybody else who's a decision maker on what to be done in the rest of the year. This time, of course, because of the lockdown, it was a nice experiment, and, it got reported extensively, but not otherwise. And yeah, this is not a conversation about stubble, but even there, the numbers are looking not as less in Punjab, for instance, even at this point today, as one would imagine. Like, the fires are indeed burning, and it just seems like it's going to be complicated. But Dr. Sharma, if you're still online, are you there, and am I audible properly? It was possible that Dr. Sharma will have bad internet.
Yes. No, can you hear me?
Yes, yes, can hear you.
Can,
Are you able to talk, sir?
yes, yes, I'll be able to talk.
So, first of all, we made all the presentations, and I'm sorry that you didn't have a proper way to go through them. But really, we did all the analysis of the manual monitors, how they are looking, the state of play with respect to all the states, etc. My question to you is twofold. Since you're also involved in setting up monitors across several locations in the country, I just want to understand from you, how important do you think this exercise is, what we have done from a health perspective? And my second question is more topical, and because we know that you're involved in the COVID task force as well, what kind of, as I said before, experiential or anecdotal evidence, even if not hard data at this stage, on the impact of COVID, on the impact of air quality on COVID? There have been reports of people coming back to the hospital for repeat admissions. In Gurgaon, I think there have been several cases, though it hasn't been documented as such and formally. So anything that you can share with respect to the ongoing pandemic and how air pollution is worsening it, or what is your view on this? You will have 7 to 8 minutes, so please use your time. I will give you the floor now.
Thank you, Aarti, and good morning, everybody. Fortunately, there's a good thing that throughout the journey, I was able to remain connected and listen to this Ronak and Santosh speak. So I got myself updated with whatever is being done in NAMP, and thanks for that. So at least we have good internet connectivity on the highways now. That's one inference I will draw. Now, now,
Right.
coming to your questions, number one, finding that there is some kind of monitoring available, be it manual or be it automated. The fact that there is monitoring and there is data available on pollution status itself is a positive sign. Because I remember about a year ago or a couple of years ago, when we had been talking on similar forum, Ronak will agree to that, that we had this biggest problem that in majority of the non-attainment cities, the data on pollution as well as data on the health scenario was not available. So moving ahead from that, if we know now that even by manual monitoring with a delay of 2 to 7 days, if the pollution data is available, it can be very easily collated with the health data if and when available, and we will be able to make a definite connection or establish the relationship between the status of pollution in those cities with the health condition. Now I repeatedly keep saying the same thing, and I don't mind repeating here again, that majority of the health models or the mathematical models that are trying to find a relationship between air pollution or air quality and health are based on Western models because of lack of data in our Indian context. So once having known that such data is available, and if we can make some effort to get even tangential health data related to pollution, we will be able to find the true status of burden of respiratory diseases and other pollution related diseases city wise or zone wise or geographically distributed. That will be of immense benefit, because ours is a heterogeneous country, not only in terms of pollution but in terms of social, cultural, demographic and other behavioral parameters which influence human health. So if we have all these components of the jigsaw puzzle in place, we have data on nutrition, we have demographic data, and we have socio-cultural data. But this air quality data being made available now, and along with improved access to health status data, we will be able to make a complete picture of that in multifactorial etiology of most of the diseases which have contribution from our nutrition, our socio-cultural milieu, as well as air pollution. We will be able to do, just like you do source apportionment about air pollution. Now I can extend that terminology and say that we will be able to do risk apportionment of different risk factors contributing to causation of one disease in the community, be it COPD or be it bronchial asthma or be it diabetes mellitus or be it hypertension. So from that perspective, I see it as a very good sign that we are able to get this data. And through this forum, I will say that if there are medical professionals or if there are uh, government if there are government agencies involved in this, they may be able to facilitate acquiring or making available the health related data on a similar platform. Just like you have made it accessible, the air quality data, let there be another platform which can provide us the relevant health quality data. And it will be important from both point of view. The acute diseases where the manifestations are happening in a very short period of time, and the chronic diseases advantages which I was earlier talking about on both parameters if we have the data. And it's not very difficult to get. For example, in a small city, if the private practitioners who are seeing cases, if they can provide this information that in a given time period, how many cases of acute infections of the respiratory system or allergic rhinitis or number of acute exacerbations of chronic conditions they have seen in their clinic, and only that much aggregated data weekly or a monthly basis, that will be very useful to develop our model for developing the understanding and understanding the magnitude of the disease problem also. So I believe this is a good sign, and probably accessibility to this data will be taken, it can be taken as an example and given to the health agencies, the health ministry, the local health care bodies and the municipal corporations which have access to this health data to make it available. So that is all I have to say about this first part, that it's definitely a good beginning, or maybe on the carbon copy itself we can create a dashboard for health related data also if we get the right inputs from the concerned agencies. And that will definitely make our job as researchers or as interpreter of the data in terms of understanding the disease process better. Now, having said that, coming to the second issue, the most burning issue at this moment about COVID-19.
Sir, we lost you now. Can you still hear me? It's breaking, Dr. Sharma.
Two.
Please go on
Is a little
now.
poor. I think it's back now. Can you hear me now?
Yes, please go on.
Okay. So was I comprehensible what I said earlier, or I need to repeat
Yes,
that?
no, you were totally clear on all the health data part, but now on the other side.
Okay, so now on the other side, coming to the issue of COVID-19, I was saying that one of the most important news that is happening is that we are seeing the so-called second wave appearing in Europe. France, Italy, Spain, and UK have raised their red flags, and they are contemplating serious measures like lockdown or in France, or declaration of emergency in Spain. So that means the writing is on the wall that with the onset of winter, and as we progress in winter, there are chances that the COVID-19 cases are going to rise. Now, just a little bit about this issue of first wave and second wave. These countries are smaller, and they had a very huge impact during the summer months also, during the summer months also of the disease, but they were able to bring down the disease to a very significant level with all the interventions, and a large number of population was saved. Now, in context of India, if you look at that out of this 132 million population, at this moment, we have only 7.8 million or 7.9 million cases that has happened. That is not even 1%. What does it mean? It means that even if you take the ratio of detected cases to undetected cases in the community to a
If it doesn't come back in 2 seconds, sir, I'm afraid we might have to drop this interesting bit.
level of 1:10 or a pessimistic value of 1:35.
Dr. Sharma, can I ask you, if you are traveling, is it possible to stop for 2 minutes and speak, because the signal is continuously breaking now? And if not, it's totally fine. You can also share whatever rest remains, maybe in writing with us, because it just might have been useful.
Aarti, am I audible?
So we will give this one last try. It was completely breaking in the middle when you were talking about the ratio of detected to undetected cases.
Okay. That's all I said, that the ratio of detected and undetected cases if the pessimistic value of 1:35 or optimistic value of 1:10 we take, even then we will say that only 3% of the population has so far been infected, or at most 4%. Right. So if that happens, that means 96% of the population is still susceptible. So we have not even reached what is called the first wave. There is no question of a second wave here. And the second part is that there is not going to be a single peak in the entire country, because we saw that at different point of time, different cities or different zones has increased number of cases. Whether you take Delhi or you take Maharashtra, or now you take Tamil Nadu and Kerala. Kerala particularly, where we were already blowing a trumpet that we have achieved success, and suddenly there is the tables are turned, and now
Right.
Kerala is heading with the number of
Can I
cases.
ask you specifically on what do you want to say on the impact of air quality on this?
Okay, the impact of air quality is not well understood so far. There are controversies, but this goes uncontested that increased air pollution is likely to increase the number of COVID-19 cases. There's no doubt about it. But how much and how, to that my answer will be I don't know. And what we saw that in the lockdown period, though there was a reduction in the pollution levels, but the COVID-19 cases did not come down as a result of the lockdown per se, as its impact on air quality. So now when the lockdown is not there and the air quality levels are falling further, how will it affect? We really do not know. There's no scientific evidence to show anything except a few anecdotal. But definitely during the coming months, the number of COVID-19 cases are likely to rise. If they do not rise, then that means the interventions in terms of all protective measures like wearing mask and maintaining social distance, etc., may be appropriately followed. So if that is done, especially with mask, I believe that pollution related increase in COVID-19 cases can be controlled if the use of mask is appropriate and adequate,
Right,
particularly in
understood.
gathering.
I don't want to
Yeah.
complicate this further. Thank you very much. I know we
Yeah.
are also running against time a little bit, but I do want to say one thing from my very general understanding of the thing. I mean, of course, it's the spike in like the acute air quality spike which might happen in this time, but it's also another thing of the population having lived through 10 or 15 years of bad air and what it will consequently mean in this era of COVID. I think that cannot just be changed overnight because we have been exposed to that level of air, and I guess that should be the bigger consideration, that how in future we mitigate those kind of things. And I take your point that this time you wear a mask and you feel that you've protected yourself from pollution. But what about the irreversible impact on the lungs of elderly, for example, who have been living with this air for the last 15 years? But
And
if
definitely, yeah.
uh, thanks, Dr. Sharma. If you can just be on the line for 10 more minutes, we will see if there are any questions. I think I am going through the chat. I only see Jayshree's question. Please let me know. And Santosh, did you have a hand up?
I did. I just wanted to clarify something on the health impacts thing, but we can come back to it.
Okay, then actually feel free to come in now because I think Jeshri's question is also for you, which is just on, do we recommend assessing progress of NCAP through 3-year running averages?
Cool. Okay. So on the health impacts, first, if I could sort of just clarify my understanding on how pollution exposure affects COVID. Aarti mentioned this point on the prolonged exposure, of course, and I think there we can do very little in terms of what our exposure so far has been. But in terms of the increased short-term exposure, my understanding from the literature, Dr. Sharma, was that while, as you pointed out, there's just sort of nascent evidence on air pollution exposure and COVID-19 from the previous coronaviruses like SARS. The understanding is that uh, high pollution exposure for short term periods could essentially make an infection worse, by essentially compromising your immune system, macrophages, and so forth, and by increasing the number of receptors in the lungs, and that in terms of transmission of the virus, while there is still some debate on whether the particles are found on the aerosols, and essentially it's the hitching a ride, as it were. That's sort of still unclear. It's likely that the virus transmission increases because people are more likely to cough and so forth. And there, your point on wearing the mask is as a must is essential. Is that about right? Um, uh, and then the question on Jayashree's question on whether I recommend assessing progress of NCAP through 3-year running averages, I don't necessarily think so. I mean, my own preference, perhaps my training, because of my training, is that there could be statistical approaches to be able to identify those long-term trends, which might be sufficient. Because once again, with 3-year running averages, these issues of composition and so on, I think might make things more complicated than less. But I'm certain that there are statistical approaches that can be used to handle some of these issues. At a minimum, though, I certainly think that we need a priori a method that CPCB basically lays out, saying here is how we are going to track progress. At the moment, it seems like we are going to somewhat in an ad hoc way use these annual averages, and then different people will come up with different averages and so on, and that really doesn't help anybody's case. So yeah, I think I'll end with that.
Thanks, Santosh. We have about 5 minutes, maybe one or two more questions. There is Mohana Basu's question. What are some of the interesting perspectives this data is showing? We will share with you a highlight of what we have written, but like I said, it springs up some surprises. Things like only 15 states indeed have PM 2.5 NAPM monitoring. If you're looking at PM10 across all 3 years, then a city like Ghaziabad is the worst across the country. A city like Dehradun actually comes on number 4, which is quite surprising. You would not imagine Dehradun to be number 4, in terms of highest PM10. You have Varanasi being among the 3 lowest cities on how the number of days, sorry, or the readings of the monitors across all 3 years. And then there are some specific highlights that we have for Delhi on how PM 2.5 improved between 16 and 17, but really declined between 17 and 18, coming to an all-time high in 2018. So I think these are all these highlights. There are also more highlights on Chhattisgarh, Tamil Nadu, Maharashtra, Bihar, etc. Take a look and come back if you have more questions. There is one last question which says, how can the difference in methodology be adjusted for comparison with new data sets? How effective is 2017 as a base year considering this difference then? Ronak, do you want to answer this?
The different data sources, I mean, essentially there is manual monitors, continuous, and there are low-cost sensors. There are studies done between manual and continuous monitors. I think what I can say is, and actually there's published information, that variations between 2 manual monitors also of samples taken at the same location at the same time will show variations because, as the name implies, there is a manual process involved. I think, what people should understand is that all of these, I mean, of course, manual monitors have a federal, approval to them when the process is run in a very watertight way. So best is to compare each location to its previous year or a previous time. Comparing across locations, should be done carefully. And as Santosh mentioned that just taking a number out of context, if it is, let's say, a 6-month average or a yearly average, you need to know where the gaps are, because if the gaps are existing in the winter months or let's say the week of Diwali, then that number is not really representative of the period. So to a long answer, I mean a short answer, is that you will need to put in some effort to understand that number in the context. But manual and continuous, have a very close correlation. It's usually about 0.9 R squares between a manual and a continuous monitors, and you'll get a 0.9 R square, which typically would translate to about a 10-15% error between a sensor, a low cost sensor, and a continuous monitor. So these will give you, I think, the same monitor over a period of time is very much usable for long-term analysis. Comparing across locations needs to be done with care. That's the short answer.
Thanks, Ronak. We are also close to the hour. I think I will only summarize and reiterate from my side that in the last 1 hour, I thought, while whatever you showed on the data and the implications is for all the journalists to use, I also felt that another thing, Santosh, which you have said very clearly, is how annual averages speak much better to long-term exposure than episodic highs and lows, and that's a thing to take back. Dr. Sharma, your point was extremely well taken on making sure if this dashboard or some other way of including tangentially even the health data and related to pollution can effectively give us some kind of a risk apportionment of various factors causing a particular disease, and then there is a better way of looking at air quality management in India. I really feel that's several notches ahead, because right now we are at a time where cities are just busy doing source apportionment, and even while they might know the sources, the as part of this carbon copy tracker, the RTIs that we filed, we figured that more than 50% of the money is being spent in buying things like automated sweepers and cleaning devices, and just about 1/4 or 1/5 of the money is actually being spent on pollution mitigation. So it's clear that the most of the urban local bodies, the municipal corporations, the states, as well as the center itself, is missing the woods for the tree. We are still looking at a 20 crore putting up of a smog tower in Connaught Place. Ronak, you said the whole NMP is 35-40 crores. I think that is pocket change for a country which can install 20 crores into a smog tower. But I think the whole question is if we can actually take that leap where, while we make a case for better averages to measure air quality, but we also make a case of health being a criteria and not just standing on its own while air quality measurements standing separate. I feel that would be a step ahead. I also see no other questions, and
Aarti, if I could add just one point.
Yes, Santosh, and you will have the last word.
Yeah, so I just want to say that while we definitely need to invest in expanding our continuous ambient air quality monitoring networks across the country, NAMP data are not irrelevant. And in many of the non-attainment cities, they will continue to be the principal knowledge base for making these inter-year air quality comparisons and so on. So I hope that one other sort of outcome from this dashboard would be to sort of shine that spotlight again on the NAMP data and make sure that all the state pollution control boards continue to be collecting the samples at the frequency that they're supposed to and reporting it in a transparent manner and so on. They're certainly not irrelevant. Yeah, thanks.
Yes, agree. And sorry if I did not convey that properly, which is why Urban Sciences and Carbon Copy took that humongous exercise of plotting all the 3 years NAMP data on this dashboard, which indeed is the release of what we are talking about. But thanks for clarifying. Thank you, Dr. Sharma, for joining us while on the road. Thanks, Ronak, for all the work on this and for taking everybody through this. I will end this now. Gunjan and I will be in touch for more updates and information, but thank you very much for joining and have a good day.
Thank you. Thanks.
Bye-bye.
Bye.
Bye.